Hey, hi, Parsa. Hey, hi, Ariel. How are you? Are you awake?
Yeah.
Sort of.
I'm aware.
Sort of, kind of. Hi, Liz. How you doing? I'm waiting like 2 minutes for humans to show up online. This guy's cute. Do you see this list, Kenneth?
Yeah, I can see that.
Okay. Cool. Okay, well, I don't see a bunch of humans. Hi, guys at home and hi, guys here. So welcome. So today, what are we doing today? So you guys, these go if you want to pull out your big vocabulary list, because what do I do with these later? Why would one write these down? Ariel, help me out. Because Miss Ellis is going to, yeah. So I am, anything that I put up on these vocab lists, this is where, so they're over there. So when you're in class, you can always copy them. They're always on my recordings. And yes, Emily, I'm recording if you're watching. You're always on my recordings. These are how I write my tests. And they also give us practice. So midterm, so here's your due dates. I wrote them here. Midterms quiz on Friday, and you're going to turn your midterm list in on Friday. And so the first thing I'm going to do is answer questions about that. Y'all are going to read some x-rays today. You know, I realize you're new at it, but who cares, to be honest? We're just going to go ahead and do it. Because under the hashtag, why should I learn this? Reading x-rays is an extremely useful life skill. So if you're in the emergency room with your grandparent and their lungs are full of fluid, so we could actually look at a real film today of that. Very useful skill. So that's why we're doing it. Plus it helps us to learn anatomy. We're going to watch Bill Nye's. It's like a 13-minute summary on bones. And then you guys get your giant human project, which the first half of is due on Thursday as an upload. So you take a picture of it and upload it. So pull out a piece of paper and write these on it and go ahead and dissect the words. Go ahead and take them apart. I'll give you 7 minutes. Not yet. Let's know the day is young. Yeah. Go ahead and do that. I'm going to go get a film for us to look at. And when you're done writing them. You just write them and dissect them, that would be good. Yeah, welcome you guys that just came in. We are writing this list right now and dissecting these words with the understanding that Miss Ellis loves to put these on tests. And you have a quiz on Friday. Can you read my writing, Luz? Students always say to me, like, Miss Ellis, like your writing is like half cursive and half printing. And it's because that's the way I was taught. So if you can't read it, just tell me. I'm not sensitive.
Alice, is that
Yeah.
substernal?
Say again.
Is that substernal after
Yeah.
the word persternal?
Yep.
Okay. Yep. Yes. So Kenneth is saying, is this substernal? After here, I just put them both because we use them together in medicine. So guys, everything that I write on the board is also like what you'll read in charts, like patient charts. So if you're a sophomore in the program and you end up going to the hospital for us as a senior, you'll be just standing next to somebody like me that's a nurse or a doc, and then they'll be like typing away information using these. And if you don't know the language, you can't be there mentally. You can be what I call I don't mean this negatively, but furniture. So do you know what I mean? Like you can be furniture in a patient room, meaning your body is present, but your mind is not. And we want your mind to be present. Okay. True of our training programs as well. These are all useful in our training programs. Pharmacy tech, nurse assisting, EKG tech, all of those really awesome, what I call entry jobs. So how do you get working in a hospital? You have a skill. It's like they don't hire anybody. So when a healthcare student goes to the hospital, there's a name for it. I'll tell you what nurses say. That's an unlicensed person at the bedside. Why would we care? Do you have any ideas why we would care? Like if you're my patient and I have Luz and she's in the room with me and she's unlicensed personnel, why would I care? Don't I just let anybody come in my patient's rooms? Do what? No. So to have someone in the hospital rooms these days, so this is not true 15 years ago. 15 years ago, federal privacy laws in the US didn't really exist at the amount that they do now. So what happens in a patient room, if it's Uriel or me as the patient, it's my information. And having somebody like Luz, who's a healthcare student, means that yes, she's unlicensed, but she understands the legal problem of being in a patient room with that patient's information, right? So in other words, we've had problems. So we've had, not in our program, but we've had nursing students or even med students take a picture in a patient's room. Okay, guys, so against the law. So against the law to take a picture in the hospital of a patient. Doesn't matter who it is. Okay, you can lose your job. Okay, this is called HIPAA, federal privacy laws. Okay. Good, here we go. So this is pronounced anoxic. So the patient is anoxic. I need to do something. What does it mean? You don't have to know, Davis. Do you know? What does the prefix A mean? None or without? Without what? Ozone. So no, not ozone. So OX. Okay, let me just go get an instrument that will help me figure this out. We have to think about this. So here we go. I'll entertain the people at home. Hi, guys. If I'm anoxic, I don't have what? Oxygen. So yesterday we were talking about the patient that had, and here's one that goes down the throat. So if the patient can't respirate, we thread this down the throat, and then this piece right here connects to a ventilator so that we can breathe for the patient. This is a very important term. Without oxygen, the patient is anoxic in the hospital for all intents and purposes. This is a 911. So you're not, so I'll just write that on here. So you are not, you know, gonna be like, hey, I think I'll go to lunch. The patient's anoxic. Okay, questions about that? Okay, we just take it apart. This one. Davis, come on, help me out. Somebody help Davis. Uriel. What's this one? Some of you have had it. So do these words look scary? Can I just say that? Because they're so big. That is exactly the reason we're doing this, and because you haven't learned them. So that is the kind of the hump I'm trying to get over, is that when I see a word like this, I don't just like shut off my frontal lobe and go, I don't know. I look at the word parts. So this means joint pain, arthralgia. If any of you have it right now. Do any of you have arthralgia right now in any of your joints? Here, hip, ankle, knee, high schoolers, knees? No? Oh, so lucky. Nobody at home has it either. So here's another one that's related to joint pain. So we'll just do this one because we're going to actually be physical and do this one. We'll measure it. So this means angle. What does meter mean? Thermometer. What does it do? What's a thermometer do? Yeah, it measures temperature. So all the words translate across all vocabulary. So this just means an angle. A goniometer is an angle measurer. Why do I care about that? Why learn that? If you're an emergency room doctor and you're trying to decide, do the patient's shoulders work? So say I'm the patient that was in the motorcycle accident yesterday, and this arm was down into the pavement, right? Very painful, very ugly. Like his shirt was gone, of course. Like this part of his shirt was gone. This part of his shirt was here, but this just got rubbed off, right, on the concrete. Okay. So a way to measure that is to look, let's just look at my shoulder angles, okay? And I'll show you because mine aren't normal, okay? And they'll be helpful, okay? So can you guys see this at home? Okay, see how far I can put my left hand up on my thorax? Which, is this right or left? Left, this anatomic left. Let's look at my anatomic right. That's it, people. Are they the same?
Close, but no, seriously, that is as high as I can get that up there. Why? Because I have serious arthralgia right here. How did I do it? I hurt myself. And really bad technique made this shoulder really angry, arthralgia. That's it. That's the angle measure. So we have an instrument, looks like an angled ruler that we use to measure. Why would we measure? What would be the purpose other than saying, well, that's a train wreck right there. Why would we measure it? Any ideas? Yeah, because Davis, if you're my physical therapist and I come to you and I say, you know what, once again, I have hurt myself at the gym. And you're like, well, your left is kind of amazingly flexible. Look how big you can get this angle way up here. This one is, ooh, right there is it without pain. Your job is to make this work, and your angle measuring tells you whether you're doing it or not. Okay, and you're gonna write that down. You're gonna say, oh, she's got like 10% flexion in the shoulder. A goniometer is a measuring device to measure progress. Okay, so why learn this? Okay, perinatal services at the hospital employs about 500 nurses and about 50 docs. What does this mean? Peri is what? Around what? Around birth. So perinatal services is everything from after the baby born. So Miss Jakobauskas and Miss Probst, who teach our nurse assisting class, are both after babies are born nurses. Miss Paluzik, who's in the other room right now, is a labor and delivery nurse while the baby's being born. And then we have antepartum, before baby nurses. So this just means around birth, perinatal. So we can use this in a sentence. The patient has put themselves at perinatal risk by smoking a joint every single night. Why is that a problem? Why? Because babies need oxygen, right? And other kinds of smoke take up oxygen space, and they deprive babies of oxygen. So I'm just using it in a sentence. So peristernal, around what? Let me look at George. You guys see George? No. Yeah, can you see him? Yeah. So peristernal, here's the sternum, this big bone in the middle. So peristernal would be around it. So people, certain athletes get peristernal pain. Any idea who? There's a couple, really. Swimmers. So you think about that. So they're constantly, so these are cartilage, soft connections right here. And you're constantly doing this, right? Because when you're swimming, you're stretching one side to the other, peristernal. Substernal is down here, substernal below. So when a patient comes in the emergency room and they have substernal pain, they're like, oh, I feel all this pressure right here. If you had to diagnose them right now, what would you say? It's classic on TV. Peristernal pain. Yes. No, Kenneth, there is no hyposternal that I know, because hypo is generally a pressure measurement. So no. I think substernal will be more accurate. So substernal pain generally, and you'll learn this if you stay with Miss Jacobs next year, is cardiac pain. Right? Where's your heart? Right here. Okay. Substernal pain related to the heart. So
This is the paper that's due. It's on your assignment on Canvas. This is due on Friday. Any other questions about something on this list? Because I'm not going to review every word. If you want to look at it, if you want to ask me, what are the ones people miss? What is an arthrotomy? Anybody know? Otomy. What's arth again? Joints. To cut into, otomy. So how about craniotomy? Something you never want to have happen.
Right.
Yeah. So meaning that, so Dr. Misko, who's a neurosurgeon at our hospital at St. Bede's, probably is doing one this morning. Is it Wednesday? No, he operates Wednesday, Thursdays. When he does a craniotomy, he has to cut through this flat bone, right? With saw. So we have all kinds, and this is a cool job for a student. They have these huge rooms that are full of instrumentation, like saws. And Dr. Misko will, if Davis worked there, he'd be an operating room tech, and they'd say, go get Dr. Misko's parietal saw. That's the saw that he uses, that he likes to cut through this bone. Okay, and it does sound, guys, just like you're in a wood shop when you're in an orthopedic operating room. It's like, all these like instruments. Okay. Questions, anybody about midterms? Test is on Friday.
I have a question, please.
Go for it.
What does EA mean for orthodontia?
Oh, what does orthodontia mean? Did I not do it? What does ortho mean?
Straight.
Straight. Was that weird? Straight. And dontia is teeth.
Oh, yeah.
About teeth. Dent or dont is teeth. So an orthodontist, straight teeth. Cool. Does that answer it?
Yeah, thank you.
Okay, no worries. All right, so now what I want to do is, let's see if I can do this. This will be a tech moment for us. Yes, turn that on. So get out a piece of paper, everybody, and number from 1 to 4. Let me just see. I want to see this. No, that's not what I wanted to do. Ouch. 1 second, guys. This is way high tech for Miss Ellis. Good. Okay. So you can come up here if you need to. Can you see it at home?
Yeah.
What I want you to do 1 through 4 is to tell me what bones are broken. Tell me what bones are broken. So 1, 2, 3, 4. If you need to come up here, so there's one that's really hard to see. You can do that. Yes, are we going to turn this in? Someone just asked. Yes, we are actually. So go ahead and do 1 through 4. If you do not know, what do you do? No. So that's an awesome question usually, but Miss Ellis likes to wean her students from asking her everything. So what resource do you have that you could look to see what bone that is. You can look up there. I love it. Davis looks up on the wall. Smart person. You can go to page 48 in your textbook. If you don't have a textbook, you should have one out. Look at 48 and you tell me which bones we're looking at. I'll wait. I will wait. So this is under the idea of also why would I learn this? Because this program is 100% intent on teaching you skills you use later. So we're not like, oh gosh, you know, what can we do to entertain the children today? That is not what we're doing. So that is why these are real skills, real x-rays. Yes, Uriel.
For number one, is that the arm or?
Well, that's for you to decide. So, but if you want to come look closer, I mean, there are some details on here that you can, you know, I think you could make them bigger on your home screen too. So interesting. And there's some bonus points on here for things you might see that, so for instance, if a patient is getting a chest x-ray and they have a necklace on, will the necklace show up on the x-ray? Yes, it will. Why? Because it's dense. So things that are dense, we're reading x-rays today, Dr. Ram.
Oh, this is great.
Things that are dense are going to absorb the radiation and develop the film and show up as white. So all the things you're seeing that like that are extra light color, those are more dense, or there is some latitude for who's taking the picture to how dense they are. So we're just trying to get a hold of Dr. Ram. Why would we learn this? Here's Mr. Bayes coming in to read x-rays.
I just like seeing that, yeah.
Well, it just helps us see normal and versus, or abnormal versus normal.
And Dr. Ram could teach here for a half hour if we just stopped about the subtle nuances what are in these films. Or that's not what we're doing. We're IDing, so they're doing it on their paper. I love seeing that book out, Uriel. You know why? Because you're going to remember it now.
Oh.
If I don't tell them everything, like what is it? What is it we're looking at?
All seem pretty obvious, except number 4 with that white spot right there.
Oh,
I
yeah.
kind of have an idea.
This one? Okay, but there's a fracture here. So that's the hard one.
I can see a filling.
Don't point at it.
Can I point out the filling
Yeah, I don't know if, yes,
cavity, like where they filled it?
yeah.
See, it's more dense than the tooth.
So it's like, some,
That's-
Is that
I wonder if
that's
this-
better.
I wonder if this is artifact.
No,
No?
No,
I don't think so. Do you, Ron?
no. It's,
Well,
Is it a?
I won't say.
Okay.
no. So, yeah, so that's what we're doing. Take your time. Let me know when you're done.
Oh. I guess that makes it. The shape is this odd. Shape. is-
It's one of two things that I don't know for sure what it is, but don't say Dr. Ram yet. Okay. Then those of you that are in class, if you'll just walk back to the x-ray back there and find one bone that is duplicated in this one of these pictures and tell me which bone it is and which picture it's from. Does this make sense? So I walk back and look at that. I go, oh, that's the so-and-so. It's also in picture blah, up and go look and don't stand too close to each other. So you're not going to see it from there. You're going to have to like get it out of your chairs and go over and look at the film. One or two bones that are duplicated on these pictures that you want to tell me about. So guys, those of you that are at home will see that on Thursday. You only need a bone that's duplicated and what picture is it from?
You see it, Davis? Yeah, it's easy. It's pretty easy. Okay. Let me look at my chat. Yeah, don't put the answers in. Oh, yes, Emily? Yes, ma'am. Correct. Just direct message me. Don't put it in the chat for everybody. You're right, Emily.
You did direct message.
Say again.
You did direct message.
Oh, so I have it on here. Thank you. That's good, isn't it? Okay. So number one is what? What bones? Your arm bones. Thank you very much. More information, please. So this is what happens in the hospital, guys. If people are asking you questions, they'll be like, you go, it's her arm. We knew that. So did your third grade brother. Okay, what bones are there? And how do we tell which ones they are? They're both broken. That looks like, that's an amazingly clean, what I call a clean fracture, meaning whatever it hit so hard, it instantly broke both bones in two. So bike accident, skating accident, falling off of something and putting your arm down and then getting the angle wrong and snapping those bones. I know, painful, exactly. So where's my chat? So number one, anybody want to tell me? So on this side, so this is the hand, left hand, as though it were like this. And so the bone that's right here on the thumb side is what? Which bone? You guys have been on online school too long, way too long. That's it. Huh?
What's the question?
What is this bone? So ulna is on the pinky side, so this is how you know them. So this is how we know them. So pinky side, ulna, pinky, thumb side, radius. Radius. Okay, what else can we do? Those of you that are at home and those that are here have a radial pulse. Okay, you have an artery named after the radial bone that comes down, the vessel comes right down the radial bone and produces a cool little pulse wave right there. Put your finger on your thumb side, inside. You guys can't see me. I don't even know if you can see me. No, you can't. So guys at home, I'll fix this in a minute, but can you put your finger on your radial pulse? On your wrist. So on the lateral aspect of your anterior side in anatomic position, you have a pulse there. Do you feel it? Yeah. Okay, radial pulse, because the radial bone's there. Okay, good. Number two is what? What bone is this? Shoulder. Shoulder, go ahead. Clavicle. So really common soccer injury, football injury, lacrosse injury, breaking your clavicle. So also very painful. So you can imagine if you break your clavicle, doing really good joint extension is not happening, right? Because it will pull that bone apart every time the patient moves. So you move all these muscles, pull on that fracture side. We're going to have, you're going to have the patient in an immobilizing cast to hold it straight. Number three, easy peasy. What is it? Yes, sir. Sit louder. Femur, hardest bone in the body to break. Why? It's the biggest long bone. So, you can't see it. That big long bone takes, you saw it on our video with Reisman, it takes hundreds of pounds of pressure to break. So the only ones I've seen, to be honest, are motorcycles. So, and the way that can happen too is if the patient is turning on a motorcycle and puts their leg down at the wrong time, it'll snap it just from hitting the ground, the pressure from hitting the ground. So that's bad because then you can't hit the accelerator. Okay, number 4 in the chat line, humans at home. Tell us what number 4 is. It's harder to see, it's the hard one. Oh, maybe it's that. Yeah, we know you can't see us because we're sharing this screen. Sorry, Parsa. Good try. So mandible, maxilla. Oh, well, there's no dental fracture, but right there, that is a fake tooth. Somebody knocked their tooth out and they see the little tiny line that goes up. That's the stabilizing thing that the dentist put in the patient's bone to hold that fake tooth in the front. My daughter has one. She knocked out her front tooth in the 2nd grade on the jungle gym. So this is a fake tooth, but that's not what we're looking for. So anybody see another fracture line?
How old is that person?
This person?
Yeah. It looks like they still have their.
I still have my wisdom teeth. So lots of people keep their wisdom teeth. They do have their wisdom teeth. Good observation. I'm gonna say mid-30s. And you know the way you can tell that, and this has to do with forensics. You can tell by whether or not this bone has eroded. See, all these teeth are implanted nicely and the bone comes way up high here. As you get older, they recede a little bit. So the fracture line is right here. This person has a broken jaw. I don't know why, but broken jaw there, broken mandible. Mandible. Okay. All right. Good practice. Take a picture of that, of your answers, and send them to my email now. You guys know my email?
Yeah.
Okay, send it off right now. Those of you at home, did you hear that? Take a picture of your answers and send to my email, please.
Yes, I heard that. Thank you.
Oh, that's really loud. Okay, awesome. I'll give you a minute to do that. Okay. I'm not sure that we really have time for Bill Nye today. I don't think we do. I think that's going to have to be Thursday.
Miss Ellis, have one more question, please.
Go for it.
So for our giant human project, should we only label these parts 15 parts only?
Yes, for right now. And I'm actually going to try to put that up on the screen for you. Hang on a minute.
Okay.
Because I don't think I have time to do Bill Nye today. Giant human. Okay, giant human project. We'll have to see Bill Nye. So people at home already have this project, and this comes under the category, why would Miss Ellis do this? There's always, yes, we can see the chat, Emily, sorry. I'll close it. If you have a question, guys at home, would you please just be loud and talk to me so that, and I'm just going to get back here so you can see. So this is the giant human project. You can sort of see it. I can pull it a little bit further over. So first thing is the first 15, this is off page 48 in your book. But please follow directions because that's what I'm grading. And students are always like, oh, Miss Ellis, you know, I can't draw like you do. Mine's going to be really awful and whatever. I am grading effort and accuracy. So meaning, is it important to spell these things correctly? Yeah. And not because we just love spelling. It's because we are going in medicine environments and the habit of spelling things correctly keeps you out of trouble. So if you write the wrong abbreviation or spelling for MS, so MS is an abbreviation that can mean a lot of things. If you don't know what that is and you don't write it out accurately, you can be sued, which is never a good time. And Dr. Romanek sits on a medical board that interviews doctors that have made mistakes. And let me tell you, it's a very serious event. Paying very close attention to how you answer questions about your mistake. So should we be intimidated by this? Only in a healthy way. Meaning, I don't make mistakes, or very many. I make my practice to know how to spell things because it involves a patient. Okay, so art is not being graded, but accuracy and effort are being graded. All anterior labels and everything on the first 15 are all, this was the anterior view of a human, correct? Okay. Thursday and Friday, we will put some posterior things on and I'll show you how to do that. So we're going to put posterior things like this bone right here is posterior, this big wingy bone that you have in the back. And I have to show you how to put that on. So these straight lines like this, these dotted lines, this indicates that is a anterior feature. Okay, we're just looking at it from the anterior side. The 15 that you need to put on here, I did the first one for you. This is a flat bone, of course, your frontal bone. The one that looks like a sandwich that we talked about yesterday in class. So don't go to sleep on your online days because I'm just going straight ahead through the curriculum. You'll miss it. So these 15 all need to come down here and be accurately placed. You do not need to make your giant human a boy or a girl. You do need to label where the pubic bone is. And I drew this yesterday, but remember the pubic bone comes together in the front of the pelvis and has cartilage, flexible cartilage in the front. Why? So that when you sit down and put pressure on your pelvis, it expands. Otherwise, you'd be like this, right? It would not work. So anatomically, there are always reasons. So we'll do the posterior bones on Thursday and Friday. Label your drawing with your name, but please put your name on the back side so that when you roll it up, it shows and I know how to help you find it. I think that's it. Questions? Home, do you have questions? No?
Alice, I think I'm done on my
Okay.
anterior part.
What do you do if you're done? Don't work on part 2. You can do your reading assignment with the rest of class today. You can study your med terms. You can get those ready to turn in and you can make sure that you took a picture of your x-ray assignment and send it to my email. All right, cool. I'm going to get rid of this now. Come up and get a giant human. You can also own a Sharpie. You're going to need pencils first. Does everybody have pencils?
Yeah.
You can have a whole table to yourself to spread out. And you can just probably get most of that done in this class period. Good. Okay. You're going to need to spread it out long and then put it down to flatten it so you can draw. If you need, let me move this so you can see it up close. Also, guys, somebody asked me yesterday this question. Does it matter how many ribs are on there? Of course it does. But let me point something out to you on George. There are, you can number yours like I did. I numbered the ribs that are attached, okay, up to the sternum.
all attached. Look at these two down here. They are unattached. So there are 12 sets of ribs. Put 12 sets of ribs on your drawing. The bottom two don't connect up in the front. Am I grading that? Yeah, I'm grading that. So take your time drawing. You're doing the patient's anatomic right. You might want to label that so you don't get confused on your drawing. Patient's anatomic right, patient's anatomic left. Sorry, Emily, that was not good on my part. Okay. Okay, so you're welcome to come up and look at George. Also notice on George that easy way to tell radius and ulna. There's George's thumb. There's his radius. There's his ulna. I broke both of these cleanly skating with my 12-year-old boy on a sidewalk. I caught my skate in a crack on the sidewalk and it flipped me over on my back. And when I stood up, this thumb right here was down here. Oh no. My son was like, should I call 911? And I was like, yes, right now, and get a towel. Because I wanted to kind of like move my arm around. Okay. Okay, I'm gonna let you work. Kenneth, can you send it to my email so I can see it better? Yes.
Do you need a book, Yafet?
Sure.
I have one. If you don't have yours with you, you can use this one. Kind of hard to do this project without the book. Say again?
What page is it on?
It's right there.
Oh.
Here you go.